I've been practicing bioidentical hormone replacement therapy for over 20 years, and I found this work is especially important for a subgroup of the population, those that are middle age, both men and women. It's interesting that there was a statistic I read that 2/3 of divorces, 66%, occur in the age group between 40 and 60. And I've been telling patients for decades now, don't get divorced until you get your hormones checked and balanced and treated with the right hormones, the bioidentical hormones. So again, I feel that bioidentical hormones are critically important, especially for those middle-aged men and women. First, let's talk about symptoms of women that are low in hormones. There's a menopausal stage. Most women go into menopause around 50 to 52. Menopause is simply the cessation of menstruation for 1 year, and that's called menopause. 1 year of no menses or no menstruation for a year is simply defined as menopause. But there's about a 10-year period before menopause called the premenopause or perimenopausal time. And then there's the postmenopausal time. So there's there's decades that women live either in pre-menopause or postmenopause. But symptoms of perimenopause, menopause include hot flashes, night sweats, vaginal dryness, grumpiness, irritability, problems sleeping, fatigue, and then all of a sudden they look down and they grow what we call a menopot or a pot belly. Because with menopause, what happens, the estrogen levels start to fluctuate, progesterone levels crash, testosterone usually starts to rise, so we get many times women that are angry, irritable, grumpy, and they're gaining weight and they're losing hair. The other thing that happens with these women is they start to wrinkle because estrogen is critically important for collagen production, and especially in the face. An interesting statistic I read is that approximately 5 years after menopause, women lose on average of 20 to 25% of the collagen in their face and in their body, and that's why they start getting wrinkles in their face and sagging skin and wrinkled arms and sagging thighs, because women need that estrogen, the transdermal bioidentical estrogen, in order to maintain their collagen. So again, these hormones are critically important, especially for mood, mental mood, because they help with depression, preventing depression. They help with anxiety. They help with sleep. They help with growing the most beautiful head of hair. They help with your appearance. They help with your state of mind, because there's so many people that are just so stressed. And so simply by balancing these hormones, especially bioidentical progesterone, it raises the GABA levels, which is like natural Valium, and it calms these women down. Now, when you decide to schedule an appointment, you're going to complete a few history forms as well as a hormone questionnaire. And I can usually determine which hormones you're deficient in with a questionnaire, but then I'm going to do a basic physical exam. Now you're going to see your gynecologist or primary care physician, have your GYN check with them as well as your breast exam, and bring me those reports. And then after that, I'm going to check some basic blood work as well as your hormones, your basic hormones we check. And then when we're waiting for the lab work, we'll schedule an appointment about 2 weeks later to discuss your hormone levels and our plan. And we may decide to do transdermal hormone cream therapy, or the capsules that are bioidentical hormone therapy, or pellets, sometimes injections. So there's many different ways we could administer these hormones, but we want to get the way that works best for you. I have seen the most amazing changes in women's mental, emotional, and physical health just with bioidentical hormone replacement therapy.